Hyperbilirubinemia in newborns. What is hyperbilirubinemia? It is a condition in which there is too much bilirubin in the blood, characterized by jaundice, a yellowish discoloration of the skin, whites of the eyes, and mucous membranes. Bilirubin. It is one of the breakdown products of hemoglobin that results from red blood cell destruction. There are two types: direct, which is also known as conjugated, that moves freely in the blood and is non-toxic. And there's indirect, which is also known as unconjugated, and that is attached to a protein and that can be toxic. Together, they make up the total bilirubin level. There are multiple causes of jaundice. Most frequently, it is physiologic jaundice, which occurs as a normal response to a baby's limited ability to excrete bilirubin in the first few days of life. Then there's breast milk jaundice, and that is thought to be caused by a substance in the breast milk that increases reabsorption of bilirubin through the intestinal tract. Then there's breastfeeding failure jaundice. This is the failure to initiate breastfeeding, resulting in dehydration, decreased urine production, and accumulation of bilirubin. Then there's jaundice from hemolysis. This is jaundice that may occur within the breakdown of red blood cells due to hemolytic disease of the newborn, or from having too many red blood cells that break down naturally and release bilirubin. And there's jaundice related to inadequate liver function, and this is related to inadequate liver function due to infection or other factors. This is a table that we use in the hospital to look to see the risk that the baby falls in for how old they are and their total serum bilirubin level. Typically, we'll start some type of phototherapy if they are in the high intermediate risk zone or the high risk zone. Risk factors for developing hyperbilirubinemia include jaundice that's observed within the first 24 hours of life, blood group incompatibility, premature gestational age, especially before 37 weeks, previous sibling with hyperbilirubinemia, cephalohematoma or significant bruising, East Asian race, if breastfeeding is not going well, and if there's a significant weight loss, and males' gender is more common. The goals of treatment are to reduce the total level of serum bilirubin, preventing encephalopathy, adequate hydration, and to reverse the hemolytic process by phototherapy or exchange transfusion. The reason why this is so dangerous is something that is called bilirubin encephalopathy, also known as kernicterus. This is a syndrome of severe brain damage that results from unconjugated bilirubin depositing in brain cells. Primary symptoms include decreased activity, lethargy, irritability, and loss of interest in feeding. And then within several days, the babies can develop rigid extension of all four extremities, fever, irritable, cry, and seizures. A lot of times these patients do not survive, but if they do, they can have mental retardation, attention deficit activity hyperactivity disorder, delayed or abnormal motor movement, behavioral disorders, perceptual problems, or sensorineural hearing loss. Most commonly, we use phototherapy to treat hyperbilirubinemia. This is done by an application of fluorescent light to the infant's exposed skin. This can be done by a spotlight or blankets. The baby is to wear goggles and a diaper at all time. The light promotes bilirubin excretion by photoisomerization, and that alters the bilirubin structure to a soluble form for easier excretion. Very rare you will see an exchange transfusion, and this is done by replacing donor blood with equal parts of waste blood. And this is indicated for toxic serum bilirubin levels. And like I said, it doesn't happen that often, but sometimes it does occur in the NICU. And that is it for hyperbilirubinemia.